Hello, everyone, and welcome to Plain Talk. I'm your host, AJ Rivera, and today I'm once again joined by Dr. Fred Kam. Dr. Kam, welcome back to the show.
Thank you, AJ. Glad to be here.
So, Dr. Kam, for those of you that don't know, serves as the medical director at the Auburn University Medical Clinic. Now, Dr. Kam, in regards to the COVID-19 pandemic and just Auburn's decision-making so far, especially for this semester, how involved have you been?
I've been actually very involved. I will tell you, we just passed the one-year anniversary. January 20th is when I spoke with President Gouge last year, January 20th, and discussed that I was concerned about the situation going on in China. And to his credit, he invited me to come speak to the President's Cabinet on February 3rd, where I went in and basically delivered the message that this isn't going to be an if, it was going to be a when. And as you well know, that when happened right after spring break in March.
I know we had a conversation in the fall about, COVID, what can the students be doing to help stop the spread. And I recommend everyone that hasn't seen that Plain Talk, go back, take a look at that. There'll be a link to that in the description below. But Dr. Kam, recently there have been a lot of reports of students and professors starting to receive the vaccine from Auburn University. Can you tell us a little bit about how that has been going, how that was implemented?
Sure. So, before the Christmas break, it was clear that vaccine was going to be released first by Pfizer and then not too long after by Moderna. We had a plan in place to, again, start the vaccination process and actually planned that we may even vaccinate some people over the holiday break. I would bring some of my team in from the medical clinic. Turns out we did not get vaccine, but we were well prepared. We're so well prepared that we were probably one of the only entities other than East Alabama Medical Center in the area and one of a number in the state that had access to an ultra cold freezer, which is what is required to store the Pfizer vaccine. So we had all that in place, all set up, certified both by a technician as well as approved by the state. So we could take any vaccine of any type that the state would allocate us. Lo and behold, we got a vaccine shipment back in the first week of January. That shipment arrived about 9 o'clock in the morning, and by about 3 o'clock that afternoon, we were administering injections of the vaccine. And we've been doing that ever since. We pivoted to what's called a closed pod plan that we had in place even well before COVID. And we executed on that plan, began mass vaccinations, which we did at the Coliseum. And so far, as of yesterday, we have administered 3,267 doses of the vaccine, of the 3,500 that we received.
Now, what is being used to determine who is getting vaccinated?
So a number of factors. First of all, there are guidelines from the CDC as well as from the State Public Health Department, and it comes in phases. We use the same phases or the spirit of the phase, but we had to modify it somewhat, again, to a campus community. So the first group of people to get it would be individuals who are in healthcare or supporting healthcare, and that's the group that we went after. So people at the clinic, people who are, like for example, some folks at the vet school who run their 24/7 emergency room operation, as well as the emergency surgical teams. That, again, these are people who cannot 6-foot distance, okay, have to work in close quarters, and are on the front lines of delivering healthcare to people, and in this case, animals, but also they have to deal with owners of the animals in very close quarters. So we were able to get through those phases. Then we went into people who are at higher risk. So people who are age 65 or older, have underlying health problems, and are in a situation where they will have face-to-face interaction, and it's difficult to not have face-to-face interaction where you can consistently distance 6 feet. So That was the next phase. And then we're into the further phase of, again, high-risk people who may not be in a situation where they have to do face-to-face, but they're still high risk because of underlying health problems. And that includes students, faculty, and staff. All these groups include students, faculty, and staff. And then we'll get into the face-to-face. And then finally, we've got a group of professional students, like those in the pharmacy school and the nursing school, who are on clinical rotations. Now, if they're on clinical rotations at a hospital, chances are they're going to get that vaccine done at the hospital that they're at. But many of them are not in hospital situations or in long-term care facilities like a nursing home. They're not there. So they're in outpatient facilities, etc. Again, interacting with high-risk individuals and face-to-face, can't distance 6 feet. And so those are also students that we are working to get them vaccinated. And this is all controlled by how much vaccine we get and when we get it. But that's the process. And then we'll move to a next phase, which is people without underlying health problems who don't have to be in close contact within 6 feet. And then finally, community. So beyond the Auburn group, or it could be spouses of Auburn-related faculty or staff. So we'll get to that group. That will be phase 3.
All right. So I know there has been some hesitance by people in our community, but really people across the nation about and their concerns about the safety of these vaccines. As a doctor, what are your thoughts on the vaccine safety?
The way the vaccines were tested is consistent the way all other vaccines that we use that were tested. So that's not the issue. The issue is the rapidity. Normally, your typical vaccine takes anywhere from 5, 7, 10 years to develop. This was a new technology, messenger RNA technology, which allowed for a more rapid production. And they actually started producing the vaccine as they were doing the studies, which again, normally you wouldn't do that. But it's the same vaccine that they use to test people, but to get it approved. But the actual safety and the efficacy and all those things are exactly the same timing, okay? Just it happened in a shorter period because the delays in between parts of the studies didn't happen. That would normally happen. But by all means, this vaccine is safe enough that myself, my other physicians, the other clinicians, nurse practitioners, PAs, in fact, almost all of my staff at the clinic have received this vaccine because we looked at the scientific data and we believe that this vaccine is going to be a game changer in a lot of ways as we work to get through this pandemic.
So you would recommend that if anyone that has the opportunity to get vaccinated, go ahead and get the vaccine?
Absolutely, no question in my mind.
So that kind of brings us into our next topic. Recently, Dr. Anthony Fauci has stated that it's needed for our country as a whole, if we want to return to some degree of normalcy, that our country gets vaccinated at a 70 to 85% population of Americans. And he says that he believes that we can achieve that as early as fall of this year. Now, what are your thoughts? Do you think there's a potential that just here locally in Auburn that we could see a degree of normalcy as early as this spring?
I don't know that we'll get to a degree of normalcy as early as this spring. That would be overly optimistic. I think it's realistic for us to get to some degree of normalcy sometime in fall of 2021. Again, remember, the virus has one mission, and that mission is simply to find someone who is uninfected, infect them, multiply, and transmit to someone else, okay? That's why even though we may have a vaccine, all the other measures in place to prevent the transmission of this virus has to continue all through 2021, regardless of whether you get a vaccine or not, regardless of whether you've had disease or not. So wearing masks, sanitizing your hands, maintaining the 6-foot distance when possible to do, are all parts of the strategy that works and continues to work. We just need to keep at it. Now, getting to that 70 to 85%, as my colleague Dr. Fauci has definitely said, and I totally agree with that whole process and number. We only get there 2 ways. Number 1, people getting the disease. That's not the ideal way. Number 2, giving vaccines and getting immunity that way. So between people having the disease and getting immunity is the only way we'll get to that 70 to 85% of herd immunity. Herd immunity being a concept that if enough people in a group or population has immunity to the virus, it makes it far more difficult for the virus to find someone who's uninfected and therefore susceptible and to infect and propagate. So vaccination is the fastest way to get to herd immunity. That's why it's important that we roll out this vaccine and get, again, the vaccine into people's arms and into their bodies so that they can start the process of building immunity.
All right. Well, Dr. Cam, I want to thank you once again for coming out to our show, but that is all the time that we have for today.
Thank you, AJ.
For everyone watching this at home, make sure to follow us on social media at Eagle Eye TV, or check out our website, eagleeyeauburn.com, for all updates on the COVID-19 pandemic. I'm AJ Rivera, and War Eagle.